everyone. I'm going to go ahead and call our meeting to order. My name is Chris Goff, and I serve as chair of the Indiana Justice Reinvestment Advisory Council. As a reminder, you're all mic'd up. This is a live stream meeting, and so please make sure that you're conscious of that and you speak into the microphone when it's your turn to share with the group. I'd like to welcome a few new members to our council today. First, welcome to Danny Price, who's joining us as a representative of Governor Braun. Danny has a long experience in law enforcement, was long time service with the state police, and had a chance to visit with him this morning. So Danny, we're certainly glad to have you, and I hope you enjoy your time with JRAC. And then also want to welcome back Ashley Stevens, who's kind of a blast from the past, who's our IACAC representative this year. So Ashley, we're certainly glad to have you, and welcome back. Yeah. We've got a pretty light agenda today, and the biggest new item or substantive item is an update from Dr. Ray. But the first item for the group's consideration this morning is approval of the proposed minutes from our October 31st meeting. The staff, our excellent staff, was kind enough to distribute those proposed minutes to everyone before this morning's meeting. If you've had an opportunity to look at the proposed minutes, I would entertain any requests to correct them, or if there are none, a motion to approve them.
Make a motion to approve.
Okay, thank you, Steve. There is a motion to approve the proposed minutes. Is there a second?
Second.
Thank you, Senator. So there's a motion, a second. Any further discussion? All those in favor, please indicate by saying aye.
Aye.
Any opposed? Okay, very well, thank you. The motion carries. So, Chris or Riley, are we okay with Dr. Ray now? Yeah, okay. So, next going to turn our discussion to a drug court data project that we're being assisted with by Dr. Brad Ray. Dr. Ray is a longtime partner of JRAC and the Indiana courts in particular. And I'm told that we have Dr. Ray joining us remotely. Good morning, Dr. Ray. Can you hear me all right?
Yeah, can you hear me all right?
Yeah, it's good to see you. Thank you for joining us. Well, Dr. Ray, you've been carrying out some work with respect to our drug courts, and we'd ask you to make a presentation, a little bit of an update on the work that you're doing this morning. Can you fill the group in on what you've been working on?
Happily. I decided to opt out of doing a PowerPoint presentation and kind of just facilitate a conversation about the background of the work we're doing and the vision we have, if that's all right with everybody.
Yeah, no objections that I'm seeing, Dr. Ray. Thank you.
All right, well, sorry I got to look at my mug for this instead of PowerPoint. But for those of you that don't know me or that I don't know, my name is Brad Ray. I'm a sociologist and senior researcher at RTI International. It's an independent research nonprofit. We're headquartered in North Carolina, but we have scientists working across the U.S. Before that, I was a professor at IUI, previous to the divorce, known as IUPUI, and I was in the department known as SPIA, which is now known as O'Neill. But I was there for 7 years as a professor in that unit. And so my research spans these public health and public safety, but I have these really two novel areas that I focus on, which are problem-solving courts and overdose prevention. And whenever I can find an opportunity for those things or to benefit each other or learn from one or the other, I try and do that. So that's one of the things I want to chat about today is some of the work that we've done in overdose prevention and how we want to bring that over to problem-solving courts. So just for background, I don't know if did you all get that 1 page or 2 pager that I wrote out?
Yeah, we do have it. It was distributed. Thank you, Dr. Ray.
Yep. Okay. So if you'll see in there, there's this term that I use very often, and that's called record linkage. And I just want to start with a definition of what I mean by that. So in my work in problem-solving courts, like many researchers that have done problem-solving court research, one of the main outcomes we're looking at is recidivism. So sometimes when we're looking at recidivism, we'll have a name of all the people that are on the court docket, and we'll look up each of those names to see were they in jail before and after. Other times when we have very large courts or very large data sources, thousands of participants, we'll do record linkage. So that is, we'll ask the computer software to look at the tens or hundreds of thousands of jail records and find those individuals that were in the problem-solving court in their jail records. Tell us how many of those jail records occurred before, during, and after their time in problem-solving court. So that's what I mean when I refer to record linkage, is finding people in these other administrative data sources. So I know this is a long-winded background, but I want to kind of give it all to you so you know where I'm coming from on this. When I was there in Indianapolis back in 2013, I started one of the first projects where we were doing naloxone with law enforcement. And so this was training, officers to have the opioid overdose antidote, naloxone, also known as Narcan. And when I did that work, there was all sorts of research questions that started to bubble up. And one of them was, how frequently do people repeat? How frequently do you see people repeating non-fatal overdoses? And to answer that question, we needed to also know how many of those people that were overdosing non-fatally went on to die. And so this was a big record linkage project that I did in Indianapolis. First study to do anything like this, where we record linked up non-fatal EMS records to death records. And we discovered so much in doing this. Just, high level, we discovered 2/3 of the people that die after an overdose are over the age of 65. And so these are older adults dying from non-drug related outcomes, right? So we just discovered a lot doing that. And once I completed that project, I was approached by the Indiana Management Performance Hub, which at the time was a very new state agency. And they brought me in because they asked if I wanted to replicate that study statewide in the state of Indiana. And I became pretty enamored early on with MPH, and I'll talk about some of the advantages that I found of working with them. But I started to go to the Management Performance Hub. I would sit there 2 days a week, learn about the various data systems they had, learn about how they integrate those data systems together. And so we started to work on replicating that study. What I discovered in doing this work with MPH was a couple of things. One, they had way more data than I could have even known was out there. So they had data sources I hadn't even envisioned. The second was, I had always been very stressed and concerned about data transfer. That is, I would be getting data from these agencies. I would be having to transfer that data to sometimes get linked. And I do not like being in that position. I do not like getting identifiable data if I can avoid it. And so the advantage of going through MPH was that I would no longer get that data. They would keep that data in-house. They would do the record linkage. The other main attraction to me about MPH was that it was really driving policy. It wasn't just about putting out research articles. It wasn't just about, getting things publicly disseminated. There were many examples where I could see people look at the work that they were doing internal to MPH, and that was driving policies there. So we were always looking for opportunities to take this state data system and take it down to local counties. And a couple of years ago, this got presented to me through overdose fatality review teams. There's over 20 overdose fatality review teams across the state of Indiana. So what we did was, and how these overdose fatality review teams work is, it's a group of 10, 15 people getting together once a month. They review 2 deaths, and they'll go through that person's life before they died. And they would record things like, was this person in jail before they died? Was this person in prison before they died? Were they seen by the EMS before they died? And I realized we could be doing that at the state level and delivering that to the overdose fatality review teams. And it wouldn't just be on the cases they reviewed. It could be on all of the cases in their county, going back in time and in real time going forward. So we applied to NIDA, NIH, and we received funding, myself and Indiana University colleagues, Matt Alsma, and we got a study going called Fortress. And that is some of the materials you'll see that I provided with you. With Fortress, we created a real-time dashboard that is record linking data. Anybody can go to this. It's a publicly available dashboard. And one of the first papers you'll see there was just our proof of concept. What does it look like when we record link these data? How many people that die were in jail prior to their death, but also importantly, how many people that leave jail go on to die? So we could answer all of these questions and develop this dashboard. And the other thing about, that's the kind of first paper there is on that proof of concept. But the other thing that was really great about doing this was We also engaged with what we refer to as human-centered design researchers. So it wasn't just researchers developing the dashboard. We worked with the people who were going to be using it, the end users, and figured out what they would need in a dashboard. So now we're out there. We currently have this study going. We're going to the various overdose fatality review teams in Indiana and training them in this dashboard. But I've always been looking for other opportunities, again, to take the state data down to locals. And that's when the opportunity from Mary Kay, prior to her leaving, and Chris started to get presented to me around problem-solving courts. That is doing a more robust, standardized evaluation of problem-solving courts in Indiana. And the vision that started to emerge from this was of a real-time dashboard that is evaluating problem-solving courts in Indiana. And the third paper that I put there is also kind of that proof of concept where we've already actually done this. In Marion County, several years ago, we linked up, first study ever to show that problem-solving courts not only reduce recidivism, but they also reduce EMS encounters. They also were reducing mortality in other studies that we looked at. So we had this ability to look at the data by linking it there. So what we want to do going forward is design a real-time dashboard. We know this is going to be a long-term process. So this is kind of the earliest stages that we're in right now. And so what we did last year was we went around and we did focus groups with problem-solving court stakeholders. We asked them, first off, I'm kind of concerned. I'm at that point where I do get nervous, like, are we all a little dashboarded out? But one of the things we learned from that was no, that we're not all dashboarded out, that judges in particular, the court coordinators would love to have a dashboard that they could look at to look at their court. Another thing that we discovered is that there is a need for evaluation. And that is, we did hear from some folks who are involved in problem-solving courts that they're having to rely on evaluation data from other cities, from other states that are outdated, and they do want to see what's happening in their courts in real time. So as we move forward in this, my colleague Catherine Gradinsky is here as well if people want to ask about next steps or where we're going. But where we really want to be careful is and I know folks in IOCS will say this pretty often, is it's garbage in, garbage out. And if we're just sending garbage in to get record linked, we won't really have an understanding of our outcomes. So our first step is really understanding what is the data that is being input on problem-solving courts now. And then how can we move towards improving that type of data? And then from there, moving into record linking to various outcomes so that we can look at things like recidivism in jail. We can look at things like EMS encounters. We can look at things like mortality and medications and a multitude of other outcomes. So I will stop there and see if anybody from the table has any questions, comments, feelings, ideas, or raw emotions on this.
Yeah, Dr. Ray, thanks for that update and that overview. Do council members have questions for Dr. Ray or his colleague? Yes, please, Steve.
Hey, Dr. Ray, Steve Luce with the Indiana Sheriff's Association. It's good to see you. And I don't know if this is a area or it's a problem in our jails when we have intake, and I don't know how we can, as the jails and the sheriffs, through maybe jail medical or jail management systems, collect data to help your initiative. But one of the biggest things we're trying to solve is managing substance withdrawal in jails and how it's linked to jail deaths, because it seems like that is a trend not only nationally but in Indiana. The last couple of years we've seen the jail deaths connected to withdrawals, and the fact that a lot of the small, medium sheriffs, they just don't have the staffing, the tools, or the budget to implement probably what they would like as including national jail standards as part of their decision-making tree to have the correct or the right amount of medical care. So it's just an area, I don't know if it has a place for this and what you're talking about, but it's definitely a trend or something I think the ISA we're trying to solve or assist our sheriffs with, and probably educate our association of Indiana counties, because they're the ones who are, through the budget process, the sheriffs go to the councilman to try and get them on the same page, because I feel like there's something here where we could work jointly and providing even better data for you.
So kind of diverting from the problem solving course, Steve, but I appreciate this conversation a lot. So one, if you do get a chance to look at that Fortress dashboard, one thing you would notice on there is that actually overdoses post jail and some facilities are reducing. And we think that that is in part to the distribution of naloxone in those facilities. Indiana Overdose Lifeline, and I have the benefit of being able to say that I work with multiple states in this space now. Indiana is doing an amazing job of cranking out naloxone. Overdoses are down in Indiana. I believe it's the second or third reduction in the country. So just straight up hats off to the work y'all are doing there. That being said, this issue of withdrawal, overdose, death in jail, it is still our biggest touch point. It is still the biggest touch point of where we see people dying is post-incarceration. I have not looked at the IRACS program. I know that that's something that folks are examining right now to see if that's had an impact. But I think the big push in Indiana in that space needs to be figuring out how to compel sheriffs to implement medications for opioid use disorder, in particular, buprenorphine. There are many facilities that are not providing this. I get nervous too because, as Indiana is providing more buprenorphine, that's creating more lawsuit opportunities at each of these jail facilities. So if somebody comes into a jail facility and they have an active script for Suboxone, which is also known as buprenorphine, and they don't get it when they're in that jail facility, that is a violation of their ADA rights, which opens up that jail facility to a lawsuit. And so I think we need to figure out how to get these medications in there. And I know I very much understand how strapped for resources all these places are. I've done this work in other states. I did this in Boone County with the folks there. And I think one of the first things to start with is that jail screening. How many people are actually coming through, just for even a 30-day period, how many people are coming through that facility that need these medications? And I think one thing when I've done this at facilities, one of the first things I see is sheriffs and jail administrators realize, and sheriffs, jail administrators, and in-jail medical providers realize that it's not as many people as they think. And it's, very few people actually will need these medications. And so it's really compelling those medical providers to make sure that those medications are available. The other thing that I think, and I don't have concrete data to back this up, but we've seen this anecdotally, is having these medications available inside the facilities will reduce incentives for corrections officers to violate the law by bringing them in. We've all seen newspaper stories of correction officers smuggling in narcotics into jail facilities here and there. Very often that is buprenorphine, because they know as people are going through that incredibly painful withdrawal, people will pay money to have that medication. So I think there's a lot of work that needs to be done, but that is the medication that I would focus on that would reduce this withdrawal, further decrease overdoses, decrease noncompliance amongst correction officers. So yeah, that's where my focus would be.
Any other questions? Oh yeah, Chris.
Yes.
Yeah.
Hi, Dr. Ray. Chris Naylor, Prosecuting Attorneys Council. Good to see you again. With your current project, thank you, Chris. With your current project, is it going to be possible to maybe have significant sample sizes of those people who are in drug courts compared to those people who are not in drug courts, who may have similar backgrounds, similar offenses?
So it's a good question, and I'm really glad you asked this. So in doing those focus groups, one thing that we discovered people are ready for dashboards. We discovered that people really want to know how did things change once that person got into problem solving court. So if they had 50 arrests in the 3 years before, what does it look like afterwards? People want to know that. Where we started to kind of come off the rails a little bit was in this comparison group and how to develop this comparison group. We did come up with a plan for developing a comparison group that would be inclusive to just drug courts by using pretrial risk assessment information. So this is a path forward that we could do in some counties. But right now, our first stage is really to just focus on that pre-post. So instead of having a comparison group, having individuals serve as their own comparison. So I think that's how we're going to proceed for the short term. And as we get there, we'll continue to look for comparison groups that could be broader to all problem-solving courts. But right now, we're just going to focus on that pre-post period.
I'm Dr. Ray, Mark Spitzer, Indiana Judges Association. I'm also a problem-solving court judge. I've got a drug court and a vet court. What I'm interested in, we know that there's a fair amount of, I think Chris will probably tell us, a fair amount of variability in terms of sort of use of best practices amongst courts in the state. And I think the ability to comparatively look at what courts have implemented, MAT, peer support, sober living, things like that into their programs, and then how does that have an impact on outcomes? I look at our courts in terms of our outcomes over time, and as we've implemented each of those types of interventions, we've really seen that have an impact on our recidivism numbers. And so, you know, I don't know, I feel like it's causation, maybe it's, you know, not, but at that point, having a bigger pool to look at those things and say, okay, these are the courts that are implementing this, here's kind of what we're seeing from their recidivism rates as opposed to those that aren't, I think would be very interesting, and then that would be helpful to us as we advocate for implementing that, funding it, and things like that in the courts across the state. So that's kind of what I'm thinking about.
So, Judge, but this is great. And I will say that is the ideal goal, is that you would be able to say, like, let's click on the courts that accept felons. Let's click on the courts that have MOUD. Let's click on the courts that have, you know, et cetera, to see how they change versus other courts. The path to get there, though, and I know the folks in this room are patient, and so am I. It's going to be a long road to get there. But part of that is going to be determining, you know, what are those characteristics that we want to collect information on that we think are different. But even bigger than that is going to be, how do we make this dashboard available? And so in that Fortress example I gave you, we decided early on that this was something we wanted to be publicly available. Any of you can go click on that link. People from around the world can go click on that link. But if we're going to be comparing Allen County and Marion County and Tippecanoe County and these, I don't know that we're going to want that out there into the world. And so figuring out how we're going to give access to people, who's going to have access to it, what courts will want to be in there, which won't, things like that. That's going to be a lot of stuff that we figure out straight up just down the road. Once we figure out how the data look, once we even figure out those characteristics that we're collecting, it's still going to be a matter of how do you access this. And so as we get further into that, I think we'll be able to determine some of the additional measures that we'd put in there.
Senator Clark.
Thank you, Justice. Doc, have a couple things. I think there's some value in maybe linking you with some of the data that we're working on this in-jail project, especially if we can sort of uniformly get people to do a book-in process that is similar across the state. That would give you a lot of insight into what people are coming into the jails with as we sort of develop that out across the spectrum of more counties over time. The second thing is, I'm not sure who you all are linking with. I haven't seen the website myself, or the dashboard rather. But in the upcoming session, there's certainly going to be a lot of discussion related to this needle exchange continuation or not, and that is certainly your area of expertise. Do you think the dashboard would be a good tool for us to utilize in the legislature for just looking at trends and things? Are you working with someone who might be able to speak to that particular topic as we move forward this year and next?
Let me go one at a time in that. So first off, in jail, I am a fan. Huge fan. And if there are things I can do to help you all promote that in jail, let me know. I think it is so wise that you all are moving in this direction, because in the past, and I know many people here know this, but I think there was 33 different jail vendors. sheriffs where sometimes when I'd say, hey, could you give me a roster of people that have been out of your jail? They would say, I have to pay my vendor $5,000 to $10,000 to just pull that data, which seems ridiculous to me. And then we had the whole thing with APRIS for a while where they had people's data, but the sheriffs didn't have the jail. In jail, much better solution, long-term, sustainable, highly recommended. So I'll just say that. Into the syringe exchange side of things. No, there's nothing in the Fortress dashboard that gets into syringes. I will say that I could send you other studies that we have done on the syringes. And I'm coming at this from a very scientific point of view. Y'all, like, we're talking about 40 years of research showing the effectiveness of these programs. And I think more than any state in the US, Indiana knows what happens when there's not a syringe service program in place. And I'm referring to that Scott County epidemic when I was there. But I do have some studies that we've done on death following release for people that are booked with syringes. People that are booked into jail facilities on syringes, which it still happens in Marion County, where you got a public health department that's handing out clean syringes, and then you have a police department that is booking those people into jail for those syringes. They are at higher risk of death upon release. So syringe service programs have been doing a great job there. And I hope that the legislature sees the way to keep them going. But, anything I could do to help with that, please don't hesitate to contact me.
Thank you.
Any other questions for Dr. Ray? Dr. Ray, really appreciate all of the work that you're doing to help our partners at the local level and to help us inform our conversations around criminal justice policy in Indiana. We look forward to our continued partnership, and we'll certainly be in touch. Is anything else you'd like to leave us with before we move on our agenda?
Keep up the good work, y'all. Thanks for all that you're doing there.
You as well. Good to see you, Dr. Ray. Have happy holidays, all right? Thank you.
You too. Thanks, everybody. Goodbye.
The next item on our agenda is report outs from our JRAC work groups. And first we're going to hear from Chris Bean for a report out on our local JRAC work group. So good morning, Chris.
Good morning. The December 3rd local JRAC, so last week, we canceled in advance, expecting the weather to be a bit more inclement than what we actually ended up getting. But I went ahead and sent out, the agenda was going to be for us to discuss sort of the makeup of the survey that will be distributed to all local JRACs that will feed the annual report. So I intended to walk the group through a discussion on the makeup of the survey. Since we weren't able to do that, I sent out a sort of proposed question or surveys, and I'm happy to receive any comments. I've received some back. At the same time, I sent it off to CEPP, our technical assistance provider. They will be taking a look at it internally with their team of individuals to give their feedback. They were instrumental last year in helping sort of with the makeup of that survey. I think this year we're going to again talk a good deal about opioid settlement funds, but also the local sort of fiscal outlook as we move forward. But if you're interested, if you did not receive the proposed survey, let me know. I'm happy to send it to you. I would love to get as much feedback as possible because I would like to get this one sent out in early January. It's going to be longer and I think actually require a good bit of work with the local JRACs before they can submit it, return it to us by March 31st. In terms of CEPP and their update, about a month ago, we were invited, Justice Goff, Brittany Kelly, we were invited to Floyd County. They hosted a local JRAC summit. It went off really well. It was an amazing event. And it's not the first time they've done it. Apparently they've had these in the past. But one of the benefits of it was CPP also presented at this, made 2 more contacts with counties that are interested in technical assistance. Our link for applications for technical assistance remains open year-round, so we are always taking requests for whatever level of technical assistance counties are interested in. They will, as I already noted, they're going to continue to work with us on that survey. Yeah, hope to have that survey sent out in early January.
Chris, thank you. We did spend internally quite a bit of time, Chris in particular, and Brittany Kelly, our behavioral health director, looking at the locals annual report this year. And the real, I guess, thrust of that was we wanted to do as much as we could to hear from the locals as to what their needs were, and to really build the report around that so that we could communicate more effectively to our partners in the General Assembly. One of the things that we heard throughout the year was that the property tax reform, Senate Enrolled Act 1, has created some problems for our local partners. And we heard our last meeting from IACAC, from Popeye, about some of the challenges that they were facing. So we wanted to get as clear a picture as we could as to how we could assist them and how we could help our partners in the legislative and executive branches understand how they could really make sure that our public safety needs at the local level were shored up. So I was really proud of the work that Chris and Brittany did. Oh, the other thing I just wanted to emphasize, Brittany, as most of you know, just for our new members, is somebody that the Supreme Court brought on to provide some more direct technical assistance, sort of expertise for our local stakeholders in particular as they navigated problems associated with behavioral health. And so we have in the last few years built up our capacity to respond to behavioral health issues in the criminal justice system much more effectively than we have in years past. But due to the nature and structure of our non-unified system, the kind of disparity in resources among our counties, somebody like Brittany really does a good job of helping our locals connect the dots. And so she was very helpful to Chris in putting together the local report. Going to be a little bit more time consuming, we think, this year, but we also think it's going to be a lot more helpful this year to our local partners. So I wanted to give Chris a particular shout out. Would also just echo what he said about Floyd County Summit. I mean, what they did down there was they really used their local JRAC to plan on how to use their opioid settlement funds to respond to local criminal justice needs. And that's a difficult puzzle to put together, but really our hope was when we rolled out local JRAC statute that would be how it would be used. So they are, in my view, probably the best example we've had so far of the locals coming together to do that effectively. And you know, I'd really shout out to our friends at the Indiana Association of Counties for making that happen. And Doug was very instrumental in those conversations. So, but it is a lot. I'm sorry we canceled that last meeting, but we really wanted to make sure that we were conscious of everyone's safety last week and had people off the roads if they didn't need to be. But does anyone have any questions or feedback that they'd like to share with Chris or staff or myself about that report?
I appreciate you saying that because many of you received the survey. I haven't heard back from everyone, so if you'd rather do it like to my face, I understand. I try to be strong. Feel free to fire away with even just ideas for questions or themes. Like I noted, by and large, the themes this year are the property tax reform, local fiscal challenges, CCBHC and CMHC coordination, and then try to get more to the enhanced data access. Part of the reason that we are partnering with RTI and Dr. Ray is in response to the locals saying on at least the first 3 years of my involvement with this survey, we don't know what to talk about data-wise. We don't know how to talk about data. Even if we wanted to get the data, we wouldn't know how to show the locals. So this problem-solving court data dashboard, potential solution. We've already demonstrated the pretrial dashboard that is beneficial or will be beneficial to the counties that have certified pretrial agencies. So we are trying to be responsive. I would love for all of you to come up with a section of questions that you all might be interested in.
Yeah, structurally, I think a lot of the pieces are really falling into place with how we're able to hear from and communicate the needs of our local partners. And are we at a point where we could transition into our discussion from the data work group?
Absolutely.
So again, if you have any questions, I don't want to chill discussion, but this is kind of a nice segue. I asked Angie to move up from the back tables because she's kind of our data superstar, and she's been, from the DOC. Well, let me also say one other thing that we wanted to make sure. One of the things I appreciate about Chris's structuring of that report was DOC is a critical partner. And so we understand that there's a lot of belt tightening that everybody's going through right now. And so one of the things we wanted to make sure is the DOC did have to make some cuts in preferences in their grants. I think it was tied to who's going to keep people out of the DOC or not. But very responsive, very good partners. And so we wanted to make sure that as we communicate to our local partners and we hear from them what our needs are, that we're conscious of the really limited resources that all of us have at the state level at the DOC. And I do appreciate our colleagues at the DOC coming together and being a part of these important discussions. We all share access to the Department of Corrections. When we can't deal with something locally, they're the partners that we can call on to deal with our folks that can create a real public safety risk. So Angie has been leading a discussion on our new data work group around those data points that Chris was talking about and how to make our conversations with our locals and then with the General Assembly and the executive branch more robust. So Angie, can I just turn it over to you for a report out from your work group?
Well, not to be put on the spot, I wasn't prepared to speak today.
Oh, I'm sorry.
Were you?
I'm sorry. Yeah, okay. So my mistake. So Angie Hensley is going to give us a report out. And Angie's also been taking the lead from IOCS with respect to that. So I apologize. Angie, would you go ahead? I know that your group met earlier this month. So
Yes, we last met on December 11th. We were talking about doing a draft survey to the other members of the data work group that were selected to do a network map and kind of get the information out so that we could see internally at least who has what data and for future projects, like if some of the things Dr. Ray was talking about and who you would need to contact for that, who would be that point of contact, those types of things. So we are actually meeting with Brendan O'Connor from our office later today, and we're going to look at finalizing that. I know he's also met with our UCD people to go over a couple other scenarios, and that should be sent out either today or the beginning of the week. Hoping to have something compiled and back by the end of January. That's kind of our goal, is to give you something to look at and have something to display at the next meeting, I hope. Then we are also looking at the strategic plan and where we want to go next. One of the things that we were discussing a little bit was the data, kind of like what you were talking about with the locals and what do they need to present. They don't know what to present to the county or where to get it. And so I've talked to at least one county that's going to try to give me their stuff, what they do, how they have it laid out, where they get it, so that we can start looking at something to work from and go from there at the next meeting. Our next meeting will be in February. We'll be sending out a meeting poll to coordinate those for the next year, and then we will send those out. So we do meet usually through Zoom, but we get to share information. So, and then I don't know, Angie, if you want to talk about your BJA project. Okay.
So it is another idea that we have talked about during our data group, and it kind of ties into the Management and Performance Hub that Dr. Ray was also talking about. So part of our BJA project that wrapped up this year is tying some outcome data to the performance data that we collected as part of evaluating all the community corrections agencies in their adherence to evidence-based practices. Moving forward, our hope is that now that we have kind of a little bit of a structure in place, that we would be able to continue to kind of track those outcomes over time. The study is not yet done. We're still kind of wrapping things up. You see, the University of Cincinnati hasn't actually finished the validation study. Like, we're still kind of in that beginning stage, and we're obviously still partnering with MPH, but we feel like we're kind of in a place that we could grow this, and it could be part of maybe dashboards that we're talking about and giving people access to this information. It kind of all ties into what we've been talking about this morning, I feel like.
Yeah.
So.
Well, I apologize for putting you on the spot,
It's
and
okay.
I apologize for not
I
reading my
love talking
annotated
about this
agenda correctly. But the point is, really, we're excited about what we learn in the data work group, and it is important because Angie, kind of the bookend or the caboose maybe of the train, that population of folks that's not going to be at the local level. It's really important for us to understand what is being done, what works at the local level to keep folks out of the DOC. And the state has a financial interest in that. We all have a public safety interest in that. Again, it's about making the best use we can out of our scarce public resources. And Angie she's been instrumental in all of this from the beginning. She's kind of our point person for administering our grants to our locals, and so she had a real keen interest in being involved in this, and we're very grateful to her and the work that she's done. So early days, but I'm encouraged about how it's shaping up. Brendan from our office has also been very helpful in helping us gather this data in a meaningful way so that it's as useful to our partners as possible. I think many of you or your colleagues have been involved in these discussions, but do any of you have any questions for Angie or Angie? Well, hearing none, thank you both, and apologies again for putting you on the spot,
It's okay.
Angie. That's all right. So that's the end of our work group report outs, and I know that Danny told me he had to go to a budget meeting soon, but we usually take just a few minutes at the end of the meeting to just give a report out on things that might be important in our own shops and that might be of interest to the group. So I know you've got a time crunch. Can I ask you, is there anything you'd like to share, Danny?
The only thing that came to mind while I was listening to you speak was the recidivist program. Are you well aware of that, the DOC's looking at? Is that going to fit into this at all? Do you know enough about it, even as, because it's a new program the DOC's looking at?
Yeah, we're
Christine, perhaps you know.
Yeah, we're just looking into it. Just had a couple meetings to discuss it. I think at some point, yes, I think that is something that we can definitely look into. So I don't think we're far enough into the project yet to determine like what all it's going to
So
entail.
it
Yeah.
wouldn't
Yeah.
conflict any? That's
No,
that's amazing.
no, we're good.
Really, I appreciate it, being the new guy.
Yeah.
That's all I got.
Oh, no.
Well, I mean, we're really glad that you're here. We work very closely with Doug as Governor Holcomb's representative to this, and a lot of the successes that Dr. Ray shared were attributable to the work that Doug did in the administration. So having you here directly to be able to respond to our stakeholders is just really key to being responsive to our public safety needs. So great to see you again, and look forward to working with you, Danny. So thank you. Cam, can I ask you to share out anything going on at the Indiana Association of Counties?
Yeah, I know that although the legislature's not in until the 5th, it seems that we've been in full swing of that, just meeting with legislators at the State House. And also this week I spent my time at the election conference down here at the Hyatt for the county clerks. And I know we also got a new director of governmental affairs, Jamie Bolser from the DLGF, who many of you may be familiar with. She's replaced Ryan Hoff, who's our previous general counsel. So as far as an update, that's what's been going on at AIC. But
Really appreciate your partnership. Complicated pay structure for our justice system. The state pays a lot, but the locals pay a lot. So about 70% of a county's budget goes to the justice system. So we want to be real cognizant of what those limits are, and we appreciate you being such a good partner. So happy holidays, my friend.
Thank you.
Angela, how are you today?
Well, thank you.
Yeah. What's going on with Popeye?
We are planning our Management Institute in March. We're also tasked with the new Chief Probation Officer orientation, so we do that. I know that we had a few Popeye members go to the last AIC meeting. That was good to hear from them, and they received us coming in, so.
Well, always good to see you. You've been at another administrative meeting with us within the week, so appreciate your leadership and appreciate your partnership, Angela. Good to see you. Doug, how are you? How's CJI doing?
We're great. Our youth funding RFP for community diversion or community alternatives, diversion, and behavioral health will open for 60 days in January. We have changed everything about this. The application process has changed. The way that we are going to manage the contracts and do compliance has all changed. And so it should be much easier. I'll be sending it out to this group, so please share with all of your constituents and ask them to share with their communities. They may not be the right person to apply, but somewhere in all of these communities, there's $40 million that are available in the youth funds. And so our hope is that we can exhaust that money in this round of funding so that we can go back to the legislature and ask for additional funds. These programs are vital to keeping kids out of the system in the first place. The status of the criminal justice report is almost finished, and so when we have that completed, we'll send that around, because I know everybody would love to spend their holidays reading that. It might be a little different this year. We have a different group of individuals who have been writing that report. And then finally, in the end of January, we'll be releasing our Victims of Crime Act funding. We have seen a 40% reduction in this funding over, for this funding release. So we've been communicating with all of our grantees and our stakeholders on this, so nobody should be surprised. We're also doing a number of things to mitigate it. We'll be releasing some state funding that we have to hopefully offset some of those, to move some people onto some different funding streams. But it will be a bit of adjustment for our grantees moving forward.
Well, I always appreciate hearing from you, Doug, because you always come with solutions, and that's good to hear. When you were talking about the pot of money that's there for youth, it's not exactly our bailiwick, but it made me wonder whether or not it might be appropriate to add a question on the local survey about that, just to prompt some discussion among the stakeholders about that. It's, it could be something that'd be really helpful. It'd be worth considering.
Absolutely.
Yeah. Thank you. Judge Spitzer, how are you this morning?
I'm good, thanks. Despite what happened in the college football playoff.
Sorry about
situation.
that.
So
Yeah.
I'm touting my IU degree at this point. It makes me money anyway, so let's go Hoosiers. We're, I think, like a lot of people here, kind of keeping an eye on what's happening in the General Assembly, and I think everybody's aware that the amendment regarding preventative detention and bail is moving forward here, and so we'll just kind of keep an eye on the legislation associated with that, hopefully weigh in on that in terms of ensuring due process for people. There's an interesting HJR1, I think Chris is probably familiar with that too, the impeachment suggestion that impeachment for judges and prosecuting attorneys, and so that'll be something we'll weigh in as well. There's already robust processes to evaluate whether a judge is doing what they're supposed to be doing, and then there's a political process as well. We don't need a third way and another political process to be used against judges. So that will be something certainly we'll be weighing on. And then there's some other stuff we're keeping eyes on too as well. So just kind of diving into the session at this point.
Well, if you need another cup of coffee, we're going home. We've got you running around a lot, Judge.
Yeah,
Thank you, but you do so much for the Indiana courts and all our justice partners, so it's always good to see you, and thank you. Yeah. Hi, Chris. How are you?
Oh, I'm just fine, thanks. Just briefly, I know we're working on our timeline for the community correction grants. I know that's been out there as wanting to know when the whole process and each step of the process. So we're working on that. Should be out next week or the following week. I'm going to say next week, but
It'll be
with the
out.
holiday, it could be the following week. But just wanted everyone to know that you'll be getting that shortly. So
Good. Well, always good to see you, Chris, and I echo again, or myself, and say that thanks for being such a good partner and all you do to make sure that our local partners have what they need to keep their community safe. It's good to see you.
thank you.
Catherine, anything from Office of Court Services?
I'm just an interloper here, so I'll defer
All right, all right.
IOCS update to Chris.
Have a seat at the table. Good to see you. Thank you. Adam, anything from the General Assembly?
Yeah, Senator Pohl wanted me to update the council on a couple bills he's working on related to the criminal justice system real briefly. One is a bill that would add Porter County and LaPorte County to the gun crime task force. Right now, there are only a couple counties on that task force, and they did add Lake County last year. Additionally, he's working on a bill that would very much limit when solitary confinement could be used for juveniles. And then finally, a bill that would provide guidelines to juvenile facilities and visitation to ensure any barriers to families being able to visit kids on the inside would be removed if possible. And if anybody here has any input or questions about that, I'm happy to obviously relay those along or put you in touch with the senator.
Yeah. Well, Adam, thank you for sharing that. And as always, I was able to talk briefly to Representative McNamara's representative here today. We just really appreciate having our partners from the General Assembly present at the table. So thank you for your participation and your presence. It's really helpful.
Thank you. Happy to be here.
Angie, you want me to put you on the spot twice? Or?
Yes, please.
Yeah?
I've said enough. Thank you.
Thank you. Michelle, anything?
I have one just commercial, I guess. We're still looking for representatives for the communications work group. We have some volunteers from some agencies and some entities represented here. There's still space if you want someone on that. So please email me and let me know who you would like to participate. We're going to look at starting sometime in early 2026 to get going.
I really think it would be helpful to educate our constituents, our individual constituents, on the work that we do together and how they can be more effective in their roles when they understand how their work relates to everybody else. We have a whole bunch of newer judges, and so I know that that's one discussion that's always helpful for us to have. I know Chris is talking about, he has new prosecutors come on. There's always considerations of limited manpower, limited staffing. But sometimes our collaborative work can actually be a force multiplier when we go through and do those things. So we look forward to having a discussion about communicating the work at JRAC. So we hope that y'all are willing to participate in those discussions. Angie, anything else to share?
This is more on grants, so just, I know we're still waiting, and I think a lot of the counties are waiting on the Justice Partners Addiction Response grants that go out, because we have to do the MOU with DMHA, and then once we're still waiting on that to be finalized, and then get the money, and then we'll send it out, even though it started October 1st, so they can reimburse those expenses up until then. But as soon as we get that, we're ready to send that out as soon as possible. So, and then we're waiting. We do try to mirror the timeline of DOC for the pretrial and problem-solving court grants. So we're anxiously waiting for your timeline too. So we are trying to get more proficient with eService or Unigrants, I think, as well. And so I don't know what you guys are planning, but we will be in touch with DOC to try to maybe see what we can do to make it less painful in the county. I don't know. And I think that's probably it. We do have some supplemental one-time funding going out this year to try to help with some of the things that were happening this year, but we will be working to try to, with partners, to try to figure out how to meet those needs in the future. So.
Well, Angie, thank you again. Again, I apologize for my faux pas on the agenda. So it's good to see you. Thanks for all you're doing. Howard, anything to share with the group today?
One quick note, we did receive a notice of award, federal award, addressing homelessness and the connection with AOT. So we'll be meeting in January to work out the specifics on that, and it's just over $432,000. So wonderful. We received a little bit more than we expected, so we're excited about that.
Yeah. I'm meeting with Brittany Kelly after this meeting, so imagine you guys have been linked up to those discussions, but that's good. That's can be very helpful. We're discussing things with our partners. That's good news, and appreciate visiting with you today, Howard. So thank you for everything that you're doing for the state, and it's good to see you. I hope you have good holidays.
We'll try.
Yeah. Hi, Chris.
Hey, how are you?
Good.
You said Chris or Andrew. There's going to be a lot of people that answer. I have a couple updates. One, I'll tie to the update about Senator Pohl's legislation around their proposed legislation around visitation. YGOC, and since Doug brought up YGOC, I saw two entry points for this. So I'm going to tie it to Doug and to Adam. I recently completed and presented on two YGOC reports that are statutorily required, one being the use of secure detention and detention policies around the state of Indiana. This year, when I put together that survey, found it most interesting, or I felt like it was interesting to tell the story that I've heard from so many chief probation officers and judges, and that is the lack of capacity, or whatever the reason, of bed space around the state of Indiana to hold youth securely. Many of you may know there are only 17 detention centers in the state, and they are not spaced out well. So you have heavy spacing in the northwest, some in the center of the state, and then some to the southeast. The southwest is sort of a desert. What I asked about was the distances that detentions or probation departments or counties have to travel to securely place. It was kind of eye-opening. We got 76 counties that actually responded. That 75% of them said they travel 100 miles or more to detain a youth securely. 12 of the counties, so 16% of the total counties, have had to travel at least 200 miles to place a child securely. That, in tandem with Senator Pohl's visitation, it's going to create a real burden. It already does on the families of being able to try and travel to go and see the youth if they are being housed securely 200 miles away in a one-way trip. So if anyone is interested in that report, I'm happy to share that one with you. It actually, I included a map of where all the detention centers are in the state, and some other, I thought, interesting things around the use of secure detention. There is also one that gets to sort of what Doug talks about with the YGOC funding and the use of diversion and overrides. So we've had those updates. Sort of then on the Dr. Ray project, we are moving into phase 2 after we kind of found out in the first phase what he talked about with garbage in, garbage out. A good deal of this is garbage in. However, we have some counties that are doing a really good job of entering data. The second phase, he kind of talked about this, is looking specifically at drug courts. And we found and had 6 volunteer counties that are going to take part in this next phase that really gets at ensuring that good data is being put in for the performance measures. And of course, some really high achievers are already on JRAC. So Grant County is going to be working with Dr. Ray. Rush County is going to be working with Dr. Ray. The other counties, Marion County, St. Joe County, Montgomery County, and Decatur County's drug courts are all going to take part in the second phase of the drug court study.
Good. Not surprising, you've been really busy, Chris, so thank you. Yeah, please, Chris.
Thanks, Justice. I don't want to get off track, and Chris, I don't mean to put you on the spot, but on the juvenile detention issue, I think for the benefit of everyone, is it fair to say that it's not an issue of youth being over-detained, because over the last 15 years, there were great strides made, right?
Yeah.
But we've reached a level where a number of gun offenses and violent offenses is over capacity. I understand maybe Marion County has a new juvenile detention facility that reduced capacity by about 50%. So if that's a fair statement, that it's not a matter of over detention, it's a matter of a huge increase in violence offenses, and there's no place to safely hold these youth. Is that correct?
Let me weigh in, if I can weigh in on that, just from Grant County's experience. We had a detention facility. We don't have one now. We're thinking about, when we do a jail rebuild, adding back a detention facility. And you talk about distances to drive. That's not necessarily consistent, because what happens is if you have a juvenile that you want to detain, you have to call around and find a facility that has space. And so maybe for us, Kokomo's got some space, but maybe we got to go to St. Joe County, or maybe we have to go to Evansville. And that does a couple of things relevant to Chris's point, is that it de-incentivizes an officer who wants to have a child that's detained to sit there and wait while you're looking. And so what happens is that probably some juvenile that may need detention, it's not happening because the process is so onerous. And then it's hundreds of dollars a day when you do that. So when you're making a decision in terms of holding any youth, it's a very expensive decision for your county as well. So it's it's a broken part of our system, in my opinion, and there are plenty of challenges. And certainly, as Chris talked about, we're seeing a lot more guns with kids these days too. And so, those are some situations where detention should be an option amongst your menu of options for a child.
And I will say also, go ahead, Sheriff. Yes.
Oh, well, thank you. I was going to weigh on that as well. It is very expensive and time-consuming to have to deal with that, and you never even know where you're going to end up. But I also ran into some federal hurdles that we can't address in the General Assembly because it's federal law regarding offenders who were convicted as a juvenile. And this sight and sound separation, even if they age out and they're still in our custody, we have to obey that rule federally, even if we tried to change it at the local level. And even the ones that do get waived automatically, very often I would have to, in our old jail before we upgraded it, send them to another county. And I spoke about this yesterday at that Denton conference. One individual in particular, I had to spend about $10,000 just to have him sent up to Allen County, and he was a 17-year-old charged with murder, like in a gangland kind of a killing in Brownsburg. And I ran out of space because so many kids were in there for those kinds of charges. So it is getting very serious, and those kind of impediments, as well intended as they were, it is not really like a 10-year-old little kid that you're picturing being in adult jail. Some of these folks are way more scary than the other 90% of the guys that I had in my jail in that particular example. So I would like to maybe somehow recommend some federal intervention on this, and I know it's not going to be the top of their food chain, but that would maybe help what the judge and Chris are talking about.
That's what I was going to mention, is the direct files and the waived juveniles so Johnson County has a facility. So from our end, that's been a problem with counties calling, wanting to house waived youth or those that have been direct files. And you'll have counties like, they'll beg, borrow, or steal to get somebody.
Some won't even take them.
They're even like, hey, I know we've got juvenile A in there. We'll release A if you'll take B. So like trying to barter with what's worse, or but it's a big problem. I don't have a solution or even recommendations. But
And the trend is toward less of these facilities available too. That's probably part of your data that you're collecting, Chris, but several have closed over the course of time or have decreased capacity. And so there's more, it's one kind of situations where there's more need and there's less capacity and it's less accessible.
So, Chris, I 100% agree with what you're saying. I don't believe the detention numbers are up necessarily. The other factor was several years ago, some of the facilities that were doing contracts with the counties stopped doing contracts. Specifically, YOC had a contract with Rush. We don't have a close detention center, but we always knew we had a space available. So the other day, I was beg borrowing and stealing to try and get an individual into custody. We called 17 facilities and could not get one bed across the state for an individual who had broken their adopted mother's facial structure and had knives hidden all over the property and had threatened to kill all the family members. So we had an emergency emergency session with DCS because they were also involved in the case. We actually tried to do an acute stay on the individual, and the hospital agreed and tried to do it as well and could not find an acute bed for the individual. At the end of the night at 4 a.m., we had no other choice but to send that individual back to the home with these individuals who had been threatened, all of these things. We had nowhere we could hold them. We had already held them past the hospital stay. We'd already held them past the detention, 6 hours, and locally we did beg, borrow, and steal, and thank God to Johnson County was able to get a bed that following morning and was able to have them in place. But the contracts disappearing, the facilities all being at capacity with offenders that do need detention is just, it is past crisis, if you want my opinion, for us here, like at the local level, because we are calling all 17 facilities, and by no fault of anyone's, they just don't have the space, or they only have 2 spaces and they have to hold those for their counties and vice versa. And then when we do, we have to have our sheriff's department drive 2-3 hours both ways when they don't have the staff. So at all ends, that issue is something that is significantly impacting the local levels and the safety of the individuals themselves, the juveniles, and our communities. So.
A couple of other, because what Chris said is an issue, what Judge Spitzer said is the issue, what Angela said is the issue. All of these things are the issue. There's also, I had a county with a detention center in it that said 60% of our beds are taken up by youth that have been waived to adult court, but they have to now remain in a youth detention center, and we don't have space for the youth that are not waived and need detention beds. There's also staffing issues. So we've heard that the counties can't pay staff enough, and so they're not able to completely open up the capacity that they actually have because it becomes a dangerous ratio of youth to staff members.
Well, and that's one thing with our county. We have a 48-bed facility, and we staff for 24, so our soft cap is 24. I come from like the state perspective, and I'm like, let's open those beds. Like, let's let more people in. Our county council is like, why do we need to hire 15 new youth care managers on the county dime for other counties around the state to bring their kids in? And I see both sides, but that is just another problem I don't have a solution for.
Well, and you added the behavior health of the juveniles, and so many of the detention centers will ask you in their screenings, do they have suicidal ideations, do they have any behavior health? And the moment you say yes, that's a no. It's a hard no. They don't have the staff or the room space or the capacity to isolate those individuals and keep them away from the other juveniles. So it's just, even with the beds, you don't have the staff, and they get screened out, and we're all just left trying to find a solution. DOC used to do a safe keep for juveniles. That's been eliminated, so those options have been removed as well. Juvenile detention and detainment is in a severe crisis.
The thing about the adult waivers too is that if you look at the list of things that you can waive a kid to an adult for, it's pretty bad stuff. And those cases take a long time to resolve. The normal rhythm of sort of juveniles in detention is a pretty quick, that system is designed to be pretty quick and get them in and out and get the case resolved quickly. Adult waivers, those cases can take years. And so that's a bed that's being taken up for a significant period of time as well.
All this to say, if this is a really interesting conversation for you, read my report, because I do talk about all of these things. and also some of the things that Judge Spitzer touched on, like what are counties doing when they've made a detention decision or a decision to detain a youth, and they're unable to, what are they actually doing with the youth? So.
I think you found a topic of interest, Chris. But really challenges all over. Anecdotally, I know my daughter has made juvenile transfers from Wabash to Evansville and back, and I know it's a real challenge right now. So continue to have the discussions. Your report was made with YJOC.
That's correct.
And so
yes.
this is an issue that there are people that are working to address.
That's correct. Yes.
Well, thank you, Chris.
Yep.
Ashley, anything that you'd like to offer from IACAC?
Yeah, so we actually just wrapped up our fall training institute that we have every November. We had an individual come for our keynote named Sam Glenn, and we got a lot of great feedback. He was just very inspirational, brought a lot of just boost to our line staff, I think. We're working on the calendar for the upcoming year. We have our spring conference, which will be first. It is our leadership conference, so if anybody knows of any great leadership speakers or motivational programs that they'd like to recommend, we're definitely looking at focusing on just boosting morale and keeping all of our directors and our leadership kind of engaged in the important work they're doing with all the, the budget cuts and the stress and everything that's kind of going on locally across the state, just trying to keep everybody keyed in and understanding their impact and their importance and kind of keeping that morale up. Other than that, we're working as ICAC with a couple different pieces for the upcoming year, trying to just work on our own data collections, getting all the numbers from across the state from our members, having that information just at our fingertips so that when we are having these conversations, we're better equipped to provide the realistic numbers, the actual numbers, instead of guesstimates or hearsay. So that's something we're working on this year and looking forward to kind of really implementing as we go forward.
Well, you and your constituents do such important work in our community, so we're grateful for your partnership and really glad to see you back in your role, Ashley. So thank you for being here today. Sydney, anything to share on behalf of our community mental health providers?
Yeah, so we are coming up on the 1-year mark of CCBHC for the 8 demonstration sites. So on January 29th, we're kind of doing a year in review webinar. It's going to have our 8 demonstration site members, community partners, law enforcement agencies, Senator Kreider's going to be doing kind of a keynote speech, and then some other stakeholders will be participating as well. I have some invitations that I brought with me, but I'll send a formal one to Riley so she can share with the group, but we'd love everybody to participate to kind of hear what our demonstration sites have been doing, some of the initial data that they've been seeing and collecting, and some outcomes from there. I'd also like to extend an invitation, thanks to Brittany's leadership with the AOT cohort. We've rebranded our work group to the Justice System Work Group. The council hosts it, but we have a variety of counties, again, law enforcement agencies, disability rights groups, NAMI, kind of the whole spectrum. But part of the AOT cohort is meeting quarterly and kind of giving an update to relevant stakeholders about the progress that they're making. We're also kind of getting updates about the juvenile justice grant through FSSA. So would love everybody's participation to get more information about some of those items that are going on across the state.
Great. I know that y'all have been very busy in that space, Sydney. Appreciate your partnership, and I'm glad that you're here today. Thank you. Yeah. Good morning, Chris.
Good morning, Justice. First, I want to wish everyone a Merry Christmas, Happy Holidays. Hopefully everyone gets a little breather. We had a big week last week. We had our annual winter conference. We had close to 400 of our 900 prosecutors on the north side, and it was a good week. And a couple of highlights dealing with how can we help our folks with wellness, with mental health, physical health. It's something that we've incorporated recently because they're suffering direct and vicarious trauma. You add the crushing caseload and workload issues at a time when crime whatever's happening in DC with these grants, with the VOCA grants, half of our offices rely totally on that funding to help victims in local communities. So it's a tough time, but we're trying to figure out how can we help our people thrive and with everything that they're facing. Yeah.
Well, Chris, always appreciate your partnership. The National Task Force developed a bunch of resources that we used for court personnel. A lot of it is on the National Center for State Courts website. Be happy to connect you to some of that. But we were able to implement some of that internally, and I think that there was a really good response. So you're exactly right. What a very, very difficult position to be in, day out. And I think sometimes our folks, especially when they're short on help, it's just easy to get caught up putting out fires and not take care of your people. So I'm really glad to hear that you all are providing that support, and anything we can do to assist in that, I think it's really worthwhile. Good to see you.
Yeah,
Yeah. Good morning, Senator.
Good morning, sir. I think just a quick, some comments. I saw the revenue reports this morning, and I think that's at least optimistic that a plus is much better than a minus. However we're going to look at that or where that will end up, but that's always a good thing. I think in the upcoming session we will have some interesting discussions. Unfortunately, a lot of the oxygen was probably taken out of the room, regardless of how people feel about the last issue that we dealt with over the last months. But because we're going to be in there and out of there so quickly, I think it's going to be challenging to get a lot of meaningful things done. So I would temper expectations, I suppose, would be the way to say that. But I think we're going to definitely see some discussion to Judge's point about SGR 1. And I met with these guys yesterday. I think everybody probably believes that there needs to be some guardrails in that discussion, and I know that's being talked about, so that's a good thing. I assume that's where you were going with that. I think we'll talk a little bit about death penalty stuff, the syringe programs, immigration certainly, perhaps some township level tweaks and things for last year's, or however you look at that, this year's Senate Bill 1 from 25. I think the federal rescheduling thing of cannabis is going to be an interesting, probably not a huge thing in this particular session necessarily for our state, but certainly a discussion starter, if you will, for everybody in this particular group. I'm excited to look at Dr. Ray's work product. I didn't know about that. I think that's going to be a fantastic tool for all of us, and really something that I think we can leverage as a state to keep us kind of at the front of a lot of this discussion like you all have done. And as he said, just Merry Christmas. I hope you all have a good holiday. I'm certainly looking forward to the break and getting to spend a little bit of time with my little grandbaby and myself and not be up here. No offense. It's been a long 3 or 4 months for me.
Brett, thank you. It's just I was really pleased that you were able to serve on this because I know the depth of experience that you bring from your perspective in law enforcement and sheriff and a community that used so many of the things that we try to develop and assist. So it's really an honor to serve with you. So thank you.
Thank you. I have a lot of respect for all the members here, and I know Senator Freeman does as well. And we share Carolyn as in LA, and she is fantastic as well. So between the three of us, we like to keep it covered, and hopefully will lead to some good further discussion in his committee as our chairman.
I think so. Good morning, Steve.
Good morning. First of all, Merry Christmas to everybody. And I will tell you, this is probably my favorite meeting I get to go to every year, whether I make 3 or 4 or 5 of them. But I really believe what we are doing here, the work is the work of the people. And I couldn't ask for better partners. And I brag about this JRAC group to all my outside partners across the nation. It's just a special group. And, I love coming here. One of the things we've been addressing the last 3 years, like Chris was talking about, and Doug's been a great partner, is mental health and wellness with not only our sheriffs, our leaders, but the deputies. We've been fortunate to been awarded grants the last couple of years to implement what we feel like is a very good solution to mental health and wellness for the deputies and their sheriffs, and it's also extracting data so we can identify trends, provide them content through our National Command and Staff College that we partner with, who has subject matter experts, and they use a closed AI platform. So when you're doing daily assessments, might be 3 to 5 questions, real simple. You immediately, through the AI, get a solution to what can I do to relieve stress. So it's right there, so it's in every deputy's hands right now. And on top of that, we invested into the last 2 years policies and procedures for our sheriff's offices, because one of the roadblocks I identified was our sheriffs being one of 3 states that are term limited. Every 4 years, we're turning over sheriffs, and I know the small, medium-sized jail or sheriffs, they probably don't get to complete their policies, procedures, and that's a problem. So we have invested with a firm and a great partner, and we're going to be rolling out those policies, procedures to address risk management, not only on the sworn side, but in the jails for those sheriffs who want to purchase them for us. And again, that is also going to be loaded down into the app. So everything we're trying to make as easy as possible for our sheriffs and deputies to get the solutions. Brittany Kelly has been awesome since she's come on. I have had several calls with her. Matter of fact, the ISA, we are doing an AOT panel at our winter conference with a couple of the counties, and the purpose of that is to let the sheriffs know about the civil commitment and how they can be a partner with the judges. And I'm really impressed talking to Judge Road and Judge West in Porter County and Bartholomew County, how this AOT program, they actually take time out of their schedule to meet with these offenders. And that's a huge commitment. And I just want to thank Brittany for her support, and she's got the ISA support, because we think the sheriffs can probably identify those people we can deflect from jail. So we're going to try our hardest to help support that program. The juvenile discussion, first of all, what Judge Spitzer said about, the first contact an officer and knowing it's a long process, tying them up. We don't want to go back there because that's the first contact and maybe where they're coming into the criminal justice system. And for those who are around back in the late 80s and 90s when we had, the answer was juvenile holdover. I don't know if you remember those days. Was finding a place at the jail, a room where an officer sat with them till they could find a spot. That's where we don't want to go. My wife actually ran that program back in the 90s, and this is too much of an important topic not to make it a priority. And I hope we have a lot to do, but man, the conversation I heard today, it really woke me up, and I hope we all can help each other out with this problem, find the right solutions, and understand whether it's a county expense or a state expense, come to an agreement to where we can make sure that we're providing the service we need, because we don't want them to touch the jail, we don't want them to touch the DOC, we want to make a difference at the first opportunity we can. And then the communication group, sign the ISA up, Michelle. I'll be there, or I'll find a sheriff to be there. Other than that, I hope everybody has a wonderful Christmas, and I appreciate the partnerships here.
Well, everything you say rings so true. But the sheriffs just play such an important role in our local justice systems. And you're right, that challenge of being term limited, their job is so big that it's really important for you in your leadership role to be plugged in as you are, and you do such a good job of that, Steve. So thank you for being here as always. Only thing I wanted to share for the benefit of the group is that in the last legislative term, we had some bills passed that resulted in some courts being cut. And one of the responses that we did as the judicial branch was we created a new conference committee. Our board of directors did, to look at the administration of judicial resources. We're trying to be as efficient as we can, making sure that we are connecting underutilized judges to overutilized courts to the extent that we can, looking at ways to remove barriers to be more efficient in the way we allocate our resources. We're also looking at what's the cost of the judicial branch. So may engage some of you in those discussions as we're trying to become more efficient, and look forward to those discussions. So Judge Spitzer, if we didn't get enough work out of him, is on that committee as well because of his leadership role in IJA. So all of these things are interconnected and all part of that same conversation. So my favorite meeting as well. Enjoy working with all of you, respect all of you, and it's a difficult time, but optimistic we'll get through it together. So I hope everyone has a wonderful holiday, and we'll stand adjourned. Our next meeting is January 23rd, same place. So thank you, everyone.